So, hello and good morning, I bid to all. I am Yashwin Kumar, and I'm a third year genetics student from UKM. I'll be the moderator for this webinar today. With me today are three amazing professionals from the field of genetic counseling. They are Ms. Juliana Lee, Ms. Yoon Suk Yi, and Ms. Sharifa Azwin Omar. All participants, please stay until the end of the webinar to scan the QR code for attendance and feedback. And only those who have filled in the Google form will receive e-certs. Let me introduce our first speaker first, Ms. Juliana. So Ms. Juliana has she first started her education with a Bachelor of Science in Molecular Biology from UKM, following with a graduate diploma in genetic counselling from the University of Melbourne, and a Master's in Counselling by the University of Malaya. She is a certified genetic counsellor by the Human Genetic Society of Australasia, and has 16 years of experience working in providing genetic counselling. She's also the president of the Professional Society of Genetic Counsellors in Asia and the secretary for the Genetic Counselling Society Malaysia. She's a member of the Clinical Management and Support for National Rare Disease Committee, Ministry of Health Malaysia, 2019-2023. So without further ado, let us invite Ms. Juliana Lee.
Thank you, Yashwin, for the introduction. So firstly, I'd like to thank the organizers, UKM, for inviting us, the genetic counselors, to present today. So in our session today, we hope to give you an overview about the profession of genetic counselling. So I'll start with the introduction of genetic counselling, and also to talk about the various role as a genetic counsellor and what we do. And then the following topics will be followed by Ms. Yoon to cover on genetic services in Malaysia, and also about the Genetic Society, Genetic Counselling Society of Malaysia. And Ms. Azwin will cover on the training on how to become a genetic counsellor. So as you've heard, so I was a graduate from UKM as well, so about a very long time ago. And I was also once in your position trying to figure out what is my career path. So when I was doing my Bachelor's of Science in Genetics, also in UKM and in your faculty, I first heard about genetic counselling in one of my subjects that I was taking, and it was because of this assignment and this topic on genetic counselling that really sparked my interest to pursue this career up to today. So if it wasn't for this, I would not have been able to, pursue my dream to become a genetic counselor, and also to contribute on the development of genetic counselling in our country. So as the first slide, I wanted to introduce this picture that shows the map of the global estimate of trained genetic counselors as we have collected the data in 2017. So genetic counseling is a field that began in the US almost 50 years ago, and in the last 30 years it has grown internationally. However, in the Asian region, we only had genetic counseling, genetic counselors practiced genetic counseling about 20 years ago. And although it is widely available in developed countries, it is still very limited in developing countries. So, and also because it's due to the limited resources, so we don't really have the budget to send out potential genetic counselors to be trained overseas, because there were lack of training programs, and also there was lack of budget to create more positions, even though it was in demand. So as you can see, America has the most genetic counselors, which is about 5,250, followed by the Europe and also in the Middle East. In Australia, there are like 300 over genetic counselors, and Africa about 50 genetic counselors. And in the Asian region, it was reported as 350 genetic counselors. However, This data has its limitation because majority of the genetic counselors of this 350 are mainly from Japan and also from Taiwan. So most of the countries in Southeast Asia actually have less than 10 genetic counselors. And even though they have genetic counselors in China and India at time, we didn't really have an accurate data on the genetics professional that was practicing. So this paper, the global state of genetic counseling profession, is very interesting because for the first time, there was a paper that actually, as fully as possible, tried to gather as much data on the genetic counseling profession in globally, and not just on genetic counselors, but also on the training programs, the accredited programs, and also the certification bodies that were available. So I just want to highlight that although there were many countries, over 28 countries, that have established genetic counseling services, but only a handful of these countries actually came close to achieving the recommendation by the Royal College of Physicians, whereby it was recommended to have at least 6 to 12 genetic counselors per million population. So in Malaysia, if we have about 36 million people, we are expected to roughly have about 200 to 400 genetic counselors based on this recommendation. However, at this moment, we barely have about 10 genetic counselors to serve our population. So definitely there's a great demand for and need for more genetic counselors to be trained and to join the workforce. So this slide now shows about the current scenario in Southeast Asia. So the trend in Southeast Asian countries actually started when clinical geneticists that were trained overseas actually came back after their clinical genetics training in the mid-1990s. And this is when they were overseas, they actually worked with genetic counselors, and that's when they could appreciate the role that genetic counselors play as a team member. So when they return back to the home country to start genetic services, that's when they really advocate for the need of genetic counselors. But I guess at that time, there weren't training programs available for genetic counselors, and there were no trained genetic counselors. So that was not a suitable time then to kickstart genetic counseling services provided by trained genetic counselors. So clinical geneticists are mainly medical doctors that subspecialize in clinical genetics, and they usually subspecialize after becoming pediatricians. So clinical geneticists also conduct genetic counseling, but they are more focused in the medical treatment and also finding a diagnosis for the patient. Whereas a genetic counselor working as a team with the clinical geneticist is more focused on providing support and care to the patient and family. So both clinical geneticists and genetic counselors can provide genetic counseling. So in Malaysia, the first trained genetic counselor began practice in 2004, followed by genetic counselors that were trained from Singapore. So most of the genetic counselors in Singapore were actually trained overseas. Followed by Indonesia and Philippines that had their local program that trained their local genetic counselors. So as you can see, I would just like to focus on Southeast Asia. These are the countries that actually have genetic services. So in countries like Malaysia, Indonesia, Singapore, Philippines, Thailand, and Vietnam, we all have genetic services where they were whereby they are led by clinical geneticists. But in brackets are the numbers that shows the number of genetic counselors that are available in the country. And in countries like Myanmar, Laos, Cambodia, and Brunei, there are very limited genetic services available. However, I think in the last few years, Myanmar has shown a lot of interest in starting up their genetic services, and they're also conducting genetic counseling training. So 10 years later, from 2004, in 2014, suddenly there was a great demand for genetic counselors in the private sector. And this was really due to the popularity of non-invasive prenatal testing. So NIPT was actually accessible and offered in the US in late 2013 to 2014. And because of this, it really sparked a lot of interest among new companies and startups and diagnostic companies to actually create access in our region in Southeast Asia to provide the latest and most advanced genetic testing starting from NIPT. And because it's a genetic service, and at the time they were actually looking for genetic counselors to help support this business that they have. So at that time, I was helping consulting a diagnostic company. So that's when I had the experience to provide the support for them. And during that time, there were many tests that were promoted, such as NIPT starting, and followed by cancer panel testing, somatic cancer testing, expanded carrier testing, prenatal microarray, and then followed by whole exome, whole genome sequencing. And then in the last few years, there were also companies that are providing wellness screening and lifestyle testing and direct-to-consumer testing. So the commercial industry really focused mainly on the private healthcare services, because that's when the patients could afford these tests and they are not really covered by the public healthcare services. But the problem arises when the clinicians that order the tests are not trained in genetic counseling and also in clinical genetics. So after they order the test, there were issues to manage the reports. And when genetic counseling is not properly carried out in the pre-test, it actually caused a lot of problems among their patients, as they were not expecting a poor outcome or a negative result. However, having said that, because of the drive in the private sector, it actually creates more opportunities and the need for genetic counselors in our region. So now that you've heard about the background and the current issues that we face in the genetic services, we'll move to the definition of genetic counseling. So genetic counseling is basically a process to help people understand and also adapt to the not just medical but also psychological and familiar implication of a genetic condition. So in the process of genetic counseling, it actually involves these components of interpretation of the family and medical history to assess the chance of a disease to occur or recur in the family. So basically doing the risk assessment based on the family history. The second component will be the genetic education, whereby we explain about basic genetics, about the inheritance pattern, the options of genetic testing, what are the medical management available, prevention, and provide resource to the patient. And the third component will be on counseling, on how we promote informed choices to our clients or patients and help them adapt to the risk or the genetic condition that are affecting their family. So this definition was actually revised in 2006 and is widely accepted in the profession. And this is a specific definition by the National Society of Genetic Counsellors. So who are genetic counselors? So we are basically healthcare professionals specialized in medical genetics and counseling skills. We are not medical professionals. We are not medically trained. So we are different from the clinical geneticists who are doctors. So traditionally, most of us start work in a clinical setting, whereby we work at a university-affiliated hospitals together with clinical geneticists to see patients as a team. Some of us may work in research centers as well, and we also have patient contact. So in the past few decades, we've always started in clinical setting. Only in the last 10 years, maybe, there were more opportunities for genetic counselors to work in diagnostic laboratories, and also for more senior genetic counselors to be involved in public health departments, involved in teaching, master's program, and also some of the genetic counselors are also employed in patient support groups and corporate organizations. So how to become a genetic counselor, we basically need a first degree, and most of the first degree that is accepted by the courses are mainly in biology and helping profession like psychology, social work, or nursing. And most of the courses would appreciate if you could get some volunteer experience in disability work or have some experience in genetic services. So in order to become trained in genetic counseling, you do need to undergo a master's degree program, which usually takes 2 years to complete. And these are the list of countries that some of the list of the countries that actually have genetic counselling programs. So prior to that, when I was trained in Australia, at that time we were given an option to just go through a graduate diploma, which is a postgraduate degree. And at that time, it was not a compulsory 2-year master's program yet. And with just this 1-year program, it provides the training required to be eligible for work with the title Associate Genetic Counsellor while going through certification. And it's only in 2008 that their graduate diploma program actually merged to become a master's program. So usually after you've graduated from the master's degree, when you want to start work, you actually try to gain certification from the country that you've gained the training. So let's say if you were trained in the US, you will get certification from ABGC. So as I was trained in Australia, I would have I've gotten the certification from HGSA. So Ms. Azrin will actually go more in depth on the training to become genetic counselor. So what exactly do genetic counselors do? So apart from conducting genetic counseling to patients or individuals interested in genetic testing, we also partake in teaching and also training healthcare professionals in conducting genetic counseling. We conduct research mainly to maybe like case presentations or the cases that we've seen in scientific posters and conferences, or conduct research to help improve the current genetic services that we are delivering. So apart from that, we also contribute to publication in journals, advocate for patients that are affected with genetic conditions. Like for myself, I have helped set up the Malaysian Rare Disorder Society in 2004 to 2006, together with the clinical geneticists and also the patients that are affected with genetic disorders. And now of late, we have more genetic counselors and also we have set up professional societies for genetic counselors in our region. So there were more activities there as well. And recently, genetic counselors were also invited to participate in healthcare policy development for rare diseases. So genetic counseling is conducted and guided by these principles. So I just want to share with you, there are 7 principles of genetic counseling. So starting from volunteer utilization of services. So what it means is that no one can be pressured to actually have genetic counseling. It has to be something that they want to have. And we cannot really force somebody to have genetic testing if they don't feel that they want to have the genetic testing. Okay, so it has to be something that is volunteer, similar to any counseling sessions as well. It's the same principle that we cannot force somebody who do not appreciate counseling to actually undergo that. The second principle is equal access. So genetic counseling and genetic services should be accessible to all walks of life and population, regardless of socioeconomic background, race, or religion. So that is why most of the genetic services, it actually starts from the public healthcare setting, whereby it's accessible to everybody that needs it. The third principle is basically the client education, which is one of the most central and important component, whereby we explain basic genetics, provide information on genetic testing, its limitations and the possible outcomes, what is the benefit of doing a genetic test, provide information on the genetic condition, inheritance mode, and basically everything to do with the genetic condition that would help the family. It should be something that we provide to the client and patient so that they can make informed decisions. The fourth principle is a complete disclosure of the information. So we should disclose any information relevant to decision making and to promote the client's autonomy and the right to know. Then followed by non-directive counseling. So genetic counseling is non-directive, meaning the information that we provide in the session should be fair and in a non-biased manner. And we should not in any way coerce or give decision making to the client or the family. The next principle is basically psychosocial and affective dimensions in counseling. So we also need to understand the implications of a specific genetic condition and what impact it has to the client's social and psychological background to help prepare them to adapt to their situation. And lastly is confidentiality and protection of privacy. So especially for patients that are non-symptomatic and performing predictive testing, genetic information should be managed in a confidential manner, especially, of course, in the medical information. We also need, like similar to medical information, we also have the PDPA to actually protect the privacy of the patient. And this is to help eliminate discrimination in employment and also discrimination in healthcare insurance. So when does one refer cases for genetic counselling? So these are just a rough guideline of when there is a family history known in the family of a genetic condition, or there is a member in the family that is diagnosed with a birth defect or having learning disability and they need further investigations. Or you have two or more close relatives who have been affected with breast or ovarian cancer or colon cancer that are indicative of a higher risk of hereditary cancer. So in terms of reproductive genetics, it's mainly on pregnant women who are interested to have the latest prenatal screening or testing. So they also come forth for genetic counselling. Or women with a history of stillbirth or have more than 3 times of miscarriages. Women that have experience with when they are doing ultrasound that it was suspected to have a fetal abnormality. They are also referred to the clinical genetics to find to have genetic counselling to identify what is the underlying problem with the prenatal testing report. Women who are exposed to teratogen, which can cause harm to the fetus. For example, maybe not so common in Malaysia. For example, fetal alcohol syndrome, or women that are having drug abuse or exposure to chemical in their workplace. And lastly, adults or couples, we are also seeing them in the genetics clinic. So in 2014, there was introduction of carrier screening for genetic disorders, especially for autosomal recessive conditions. So now couples who are planning to have children, they can actually go through carrier screening to test over 300 over autosomal recessive conditions to see whether they may be carriers and they may be at risk of having a child with a genetic condition. So there are also couples, although quite rare, that are consanguineous or they are related in some ways, maybe first cousins or second cousins that are concerned that they may have risk of having a children with a problem. They also come forth to the genetics clinic. And also some patients who wish to have risk assessment for conditions like cancer or neurological problems or infertility, they're also being seen. So I would like to share with you about the process of genetic counselling because, like I said earlier, the majority of the genetic counsellors actually see patients. So there are 4 main stages in the process of genetic counselling. Firstly is the risk assessment, genetic education, counselling, and also providing support. So we'll go through more in detail. So this is just a layout of what happens during genetic counselling. So just like in any counselling session, we set an agenda, and usually the first session would not be more than an hour. So we start by gathering information, risk assessment, usually educating the patient, providing support. So these 4 categories, 4 processes can actually doesn't have to be in sequence. It can happen apart from gathering information. Risk assessment, educating patient, and providing support can actually happen any time of the session, and it usually doesn't cover in just one session alone. Sometimes we may have to split educating patients in 2 sessions, whereby it's pre-test session and also post-test session. So firstly, in gathering information, we identify what is the reason of the referral. So a lot of times, sometimes we ask patients, oh, do you know why you have been referred to our clinic? And some of the times, patients don't really understand why they are there at the clinic to be seen by another doctor. So it's always good to recap and find out if the patients really understand why they are there. And then we find out what are the patient's concerns and what are the issues that they wish to resolve in the genetics appointment. And then if they agree to continue the session, we will carry out obtaining the family history and the medical history as well. So in this picture is electronically drawn family history. So in the past, we used to draw by hand, but recently, because we have the software to draw it out electronically, that's when we will start presenting it in this manner. So we usually take a 3-generation family history, and most of the time when we receive the referrals, we only usually get the nuclear family. So in genetic counseling, when we try to perform the intake or gather information, we do still need to gather the family history and in a more thorough manner. So then followed by education patient. So we usually start with basic genetics. What are cells, chromosomes, DNA, and this really gives a background for the patient to then understand the differences between the genetic test options and the limitations between these tests. So while we are explaining about basic genetics, we do use simple analogies. For example, like in this picture, we use the genetic book of life. For example, like in a human body, it's like a book that is made out of 2 volumes, one contributed by our father, 1 volume contributed by our mother. And in each volume, there are 23 chapters that actually represents the number of chromosomes that we have. So when we have 2 volumes combined together, it is in the total of 46 chromosomes and so forth. So usually when we try to describe about mutations that cause diseases, we usually try to say that, in the book, perhaps there are typos or mistakes that has occurred that has disrupted the meaning of a sentence or a word that could give normal function to the body. And because there is a disruption, it usually causes a genetic condition to occur. So you may use other analogies like a recipe book or making a cake, for example, or something that would make the patient understand better. So in providing genetic test options, basically we'll make a distinction between a screening test and a diagnostic test. So for example, a screening test will include NIPT, ultrasound, maternal serum screening in the past, newborn screening, and carrier screening. And the main highlight of this is when they report, the reporting format is actually to detect an increased risk or a potential disease indicator, and it's not diagnostic. So it's only when there is an indication in the screening test that we usually go for a diagnostic test. A diagnostic test will usually be more accurate in the specificity, and it comprises of karyotyping, chromosome test, single gene testing, panel gene testing, whole exome sequencing, and whole genome sequencing. So this slide would just like to show you that in different stages of prenatal testing or gestation, we actually have different types of tests that are offered to them. So sometimes when we have patients that come in different gestation, it is actually managed in a very urgent manner because they have to go through confirmatory testing, and it involves decision of whether they want to continue a pregnancy or having to terminate a pregnancy. And most of the time for prenatal results, it usually doesn't take more than 2 to 3 weeks, as compared to other postnatal results, we usually take more than 4 to 6 weeks. So these are common pictures that we also use during genetic education to show the inheritance mode. And then comes the counseling issues. So I would just like to share that counseling issues in prenatal care, for example, varies, and it also depends on what type of cases that we see. So in the pediatric setting, there are another sets of counseling issues on, for example, if a child was just recently diagnosed with a condition, the family will have to deal with, accepting the bad news and how to raise a child, and the anxiety and worries of how to raise a child with a special or rare disease. But in a prenatal setting, in our past cases that we've managed, we realized that in the pre-test counseling scenario and also post-test counseling scenario, there were a list of issues that were experienced by the patient. For example, difficulty to understand complex information, concerns of confirmatory testing that has a risk of miscarriage, inability to fund for prenatal genetic testing, having to make decisions on termination of pregnancy or to continue having a pregnancy that may be affected with a genetic condition. And in our community, cultural and religious views are also very influential. So when I first started my practice, I've gathered in my experience that there were a lot of different myths about how birth defect can occur. And sometimes the mothers get blamed for having a child which is unhealthy, and how the different cultural backgrounds actually view disability. So after the stages of gathering information, risk assessment, genetic education, and counseling, lastly, we will usually follow up with providing support and resources to the patient. This is a leaflet of that is created by the Malaysian Rare Disorder Society, and we usually give written information to help patients to share this information with their family members and also maybe to their teachers that are having to teach their children. So as mentioned earlier, we also participate in genetic support group activities. So since 2006, when MRDS, Malaysian Rare Disorder Society, was created, there are two other main genetic societies known as MMS, Malaysia Metabolic Society, and Malaysia Lysosomal Society that were formed in 2006 to 2008. And recently, there are more genetic conditions that has been discovered, and there were more patients that formed support groups as well. So this is a picture of Rare Disease Task Force, where myself, Miss Yoon, and Miss Yoon were recruited to help in the healthcare policy development for rare disease. And lastly, we are also involved of late in providing public awareness and on genetic counselling, and also on the role of genetic counsellors. So it's a picture that we usually do every year, where we gather, especially on Genetic Counsellor Awareness Day, which is an international celebration, usually in November. So we will highlight all the genetic counsellors in Malaysia and also in the region. This is a snapshot of the international collaboration and publications that we have highlighted genetic counselling services in Malaysia, and also to put ourselves in the map of this profession. So as for myself, before Genetic Counselling Society Malaysia was created, we actually set up the Professional Society of Genetic Counsellors in Asia in 2015. When we have more genetic counsellors that were trained overseas that came back and started practicing in Asia. So the aim really for this society is to expand and access the delivery of genetic counselling services, to make genetic counselling services more accessible to our community. And we started out with networking, where we gather all the genetic counselors that we know, whether they're practicing in Asia or they are of Asian ethnicity practicing in other developed countries, to get to know each other and see how our practices actually differ, and also to come together to promote genetic counselling research and help with the professional development in our region. So I'd just like to share with you, so this is the first genetic counselling pre-conference workshop that we have organized during the Asia Pacific Conference of Human Genetics in 2015 in Hanoi. So PSGCA is actually a special interest group of the Asia Pacific Society of Human Genetics, whereby there are a lot of clinical geneticists, medical geneticists and scientists, and also genetic counselors who are members of this society. So 2 years later, we also had the similar conference in a pre-conference workshop in Bangkok, followed by the APCHG conference, and the latest was in 2019 in Manila, where we held the third genetic counseling conference, pre-conference in the APCHG conference. Just to show you, this is the current board of directors for PSGCA, and we actually have genetic counselors that are actually practicing in 10 various different countries. And I think we have come a long way from the last close to 20 years to actually come out with this society, and also to publish papers and develop this profession in our region. So in summary, there are more genetic counselors that are needed to provide support to patients and families. As I mentioned earlier, we should actually have at least 200 or to 400 genetic counselors to actually cater for our population. So genetic counselors help patients understand complex genetic information, and they can to help them make important decisions that will impact their lives. And role of genetic counselors, you'll be happy to know, have expanded from the clinical services, not just seeing patients, but also there are new opportunities to support research laboratories and also companies that provide genetic testing. So thank you for your attention.
Thank you, Ms. Juliana. That was very informative. Now, for the next speaker, let me introduce you to Ms. Yoon. Ms. Yoon Suk Ye, a graduate from the University of Cambridge, is one of the few certified genetic counselors in Malaysia and is accredited by the Human Genetic Society Australasia, or FHGSA. She has been involved in Malaysian breast cancer genetics studies and the Malaysian ovarian cancer genetic study in Cancer Research Malaysia since 2003, and is the principal investigator for the nationwide study in mainstreaming of genetic counselling and genetic testing for ovarian cancer patients in Malaysia, or MAGIC study. She practices as a cancer genetic counsellor and works with cancer patients and their relatives using practices as a using genetic information for risk management and treatment decisions. Her research interests in the psychosocial aspect of genetic testing and counselling in Malaysia. She has been teaching as a visiting lecturer in University Kebangsaan Malaysia in the Master's Program for Genetic Counselling course since 2017, and she is also currently the president of the Genetic Counselling Society in Malaysia, and through the society aims to increase the awareness of genetic testing and genetic counselling in Malaysia. Without further ado, the floor invites Ms. Yoon.
Thank you very much, Jasmine, for the very kind introduction. And I would like to thank the organizers for the opportunity to speak here today. Juliana has done a marvelous job in introducing what genetic counselors do in their practice, and also an overview of the type of services that are actually provided by genetic counselors. And you can see that it's across a very broad base, primarily to serve individuals with a possibility, risk, or predisposition to genetic disorders, and to use the genetic information appropriately. So, why do I show us Malaysians these slides? Well, I think what we would like to say is we have many ways of training genetic counselors, and but what's important to note that for genetic counselling, because we're dealing with issues that are very personal, which decision making is also governed by many areas of importance to an individual. So in Malaysia, we are a multi-ethnic country. We are multilingual, we are multiracial, multi-religious. And in that sense, it is so important to be able to capacity build genetic counselors that are able to serve our own population. And no one knows us more than ourselves as Malaysians. So in my talk today, I'm actually going to introduce what is currently available in Malaysia and how we are able to try and grow the areas of genetic counselling in terms of the service to support the patients here in Malaysia. Just like Juliana says, ideally we should have between 200 to 400 genetic counselors, but we're not there yet. So this is the whole process that trying to build capacity here in Malaysia. So what I'll do is actually go through where the services are, how they have been established and what their roles are, and I will move on to how we hope to expand it to the society as well. When we talk about services, it is really important to actually also have the systems in place, and that's where Genetic Counselling Society Malaysia comes in. So in a nutshell, this is a slide that shows you where all of the counselling services are in Malaysia. So this is a very interesting picture because this is the picture of our first time that we've gathered together with the clinical geneticists and the genetic counsellors to come up with the idea of having the fraternity come together, since there are not that many of us, and yet we have to serve the whole Malaysia, and to make sure that we streamline and put together a system in place so that we can build the careers for individuals who want to move into genetic counselling. So genetic counselling itself is not new. If we look back, both in UMMC and HKL, all of these were already available in the 90s. So these were the main referral centers, and this was through the clinical genetic services that first started in UMMC, then followed by HKL, and so on and so forth, and other places started to develop that service. But as you can see, they are very focused in the genetic counselling was together with the clinical genetic services, and the genetic counsellors have always trained there in these services. And these services are also, as you can see, mainly located in the Klang Valley area, and in the northern area it's only USM, and only more recently in the past year in Penang as well. So let's look at these individual services with a little bit more detail. So in UMMC, it was the first center that started offering genetic counselling services in Malaysia, and the genetic services was started by Prof. Tong Miao Kiong, and it was in the pediatrics clinic. Then Juliana was the first genetic counsellor to be employed in UMMC, and actually was the first certified genetic counsellor here in Malaysia. This moved on with other collaborations in 2007 with Cancer Research Malaysia, and that's where I work in, particularly in cancer genetics. And after almost 15 years, a special medical genetics unit was then, a dedicated genetics unit was then built in UMMC for expansion into adult services. So apart from having the clinical genetics service, UMMC has also been one of the, actually the pioneer of the training itself. So as Juliana has mentioned, before the availability of the master's course in UKM, we would need to be trained abroad. But having the postgraduate studies abroad doesn't equip us in order to be able to have the service component in terms of training. So both Juliana and I work in UMMC and are mentored by the clinical geneticists, Prof. Tong and some of his colleagues, to have the relevant training in our own systems, right? So this is really important because you'll be aware when we are trying to reach out to patients and to individualize the counseling, it takes into account many issues. So even right down to language, the sort of stigmas that are present in the society. So training is always best done in the population or in the study, in the society that you are going to practice in. So with that, we've done a lot of the work in terms of the training towards the part of credentialing in Malaysia itself, even though we were educated overseas. So this is done in collaboration with the Human Genetics Society Australasia that does the credentialing, but the training is done in collaboration with the hospital here in Malaysia. Hospital Kuala Lumpur is also one of the pioneer clinical genetic services, and it now is the main referral for most of the KKM hospitals, and it has a strong unit in the inborn errors. So it has a full range of services for general genetics, adult genetics, and cancers as well. Apart from that, because it is the main referral center for the KKM, it has outreach clinics initially in Penang, Sabah, Sarawak, and Johor. But as of a year ago, they actually started a service itself in Penang, and two of the clinical geneticists, Dr. Chang, Dr. Moy, are now based in Hospital Pulau Pinang. I apologize that I have not put in the pictures here, but now for under KKM, there's actually an additional service out of Hospital Kuala Lumpur, and it's in Hospital Pulau Pinang. So from a non-governmental side, Cancer Research Malaysia was also one of the first centers that delved into genetic counselling. So it is primarily a cancer genetics research center with a focus on genetic testing. So genetic counselling then became an inherent part of managing the individuals who are under the research studies, and also more recently for using genetic profiling for treatment purposes. Now, this is a non-profit private research establishment, and it also introduced a different area in terms of counseling expertise that's required. So I think most of you would be aware that there is a sudden burst of genetic research and the use of genetic information in the past few years, mainly because of the new technologies in next generation sequencing and the availability to generate a lot of research, genetics research data using genetic technologies that are costing less and less. So with the cost decreasing, there are more targeted treatments that requires genetic profiling. So there is a whole area that's expanding, but with genetics research comes the necessity to be able to provide ample support to the patients who are in these studies and in the trials. So it's not exactly a clinical genetic service in that sense, but patients here also deserve to have the right information to make sure that they are properly consented, and this is an area that is growing very rapidly. So in UKM, the clinical genetics services was also developed very early on, and Prof. Sarina, together with Azwin, manages many referrals across the board for all genetic conditions as well. So because UKM started the master's course in genetic counselling, which Azwin will be going into detail after me, there's the hospital also then provides the training platform for the genetic counselling students, and as I have said before, this is a very important part. The postgraduate studies gives all of the information the skill sets that's necessary for genetic counselling. But the training itself and having the on-the-job mentoring is very important in the development of genetic counselling skills and the growth of a genetic counsellor. So this course was started in 2015, and it was really important because it was the first time that we now can train genetic counselors locally. Before this, we would have to have students sent abroad, and the cost of doing a genetic counselling course abroad is very, very expensive. So this was excellent to have the course started here in UKM. I will not go into this in detail because Azwin will be covering this. So in the northern area, there's also a clinical genetics service with HUSM, and there are 2 clinical geneticists. However, there are no genetic counselors available there at this point in time, but it is also a center for training as well, particularly through their fellowship programs. So, not unlike a lot of other countries, particularly the low and medium income countries, we do have challenges in this field. So there are professional issues for genetic counselors in Malaysia, and Juliana has already talked about the shortage of genetic counselors, but for a genetic counselor in Malaysia itself, what are the challenges? So in a sense, there are still limited career development because the field is not so well known yet, right? So we are trying to change that because we would like to ensure that all genetic testing is accompanied by a proper information and counseling session for the patient. We have limited local training programs at the moment because we are still reliant on the few centers that we've talked about, and that is being stretched at the moment in order to provide enough training facilities for counselors. In addition, the professional recognition is not yet established yet. So unlike all of the societies that Juliana has mentioned in her talk earlier, we didn't have that sort of recognition and no societies to be able to bring that forward. So that's why a lot of both Juliana and I had to be credentialed by an external credentialing board. Now, because we have all of these issues, that is why the fraternity, so the clinical geneticists together with all of the genetic counselors that are here, came together and created the Genetic Counselling Society of Malaysia. So this was done in 2000, towards the end of 2018, and these are the aims and objectives for the society. So this is really important because the ultimate goal is to be able to maintain the professionalism and the self-regulation for the profession itself. So let's go through some of the aims and objectives of this society, and it is to really increase more awareness about genetic counselling, and this is not only in the public but also among our healthcare providers, and why it is important to actually have a proper counselling for individuals who are going to use genetic information. Okay. So we hope to enhance the care and service for clients and to support our members and promote their roles in the genetics team and other related genetic services. So as I've described earlier as an example in a research setting, but there are also other settings where genetic counselor skills will be necessary. So it can be in the provision of the test itself, with testing companies or with laboratories. Because the information about genetics and the overall health literacy in a sense in Malaysia is still generally low, there needs to be a lot more educational programs and the dissemination of knowledge related to genetics and genomics. This is a long-term goal, and really it's to improve the overall health literacy in our population, but hopefully in some way reduce some of the stigma that we still see with any inherited conditions in the country. So the next point is the current goal, very important goal for GCSM at the moment. So because we do not have a local credentialing pathway, so this is what the society is focusing on at the moment. And in order to do this, it has to work very closely with the governmental and non-governmental organizations as well. So in terms of raising awareness, we've had some workshops, and the latest one was in 2019, and it was very well attended, and I think we had a full program to talk about genetic counseling and to put in also some introduction skills like role plays and so on. We were really hoping to have done it last year, but unfortunately due to the MCO we were unable to. We'll see how it goes. We may have the chance to do something later on this year in the third or fourth quarter. Now, just now I've mentioned that the goal of GCSM is really to create a pathway in the system itself. So the recognition of the profession by the government, the creation of the actual genetic counseling roles in the system as well. But in order to achieve that, there needs to be a whole framework that is to be drafted out and to be created. So there are best practices for genetic counselors. Because we deal with very important issues, it is very important that this profession is regulated, and there are many ways that we can regulate this profession. So one of it is to actually start with building up a scope of practice for genetic counselors, and what's important here in Malaysia that that we need. So we do use other societies and other bodies as a guide, and we follow some of the things that they have developed. So this is generally the scope of practice for genetic counseling. So it is very much like what Juliana has explained earlier on. But just to add on, it does include things like supervision and professional development. So the more senior genetic counselors have a role in order to train and mentor the newer graduates and so on. Why is regulation important? And I think most of you will be able to understand and comprehend that there are many implications, particularly the psychosocial front, if the profession is not regulated. So we can actually cause harm if we do not provide genetic counseling in a well established manner. Right? That's why so much time is involved in the training and in the teaching of the course, because using genetic information is sometimes necessary in making decisions that may be life-changing. So Juliana has described some of the areas where it is necessary to make really difficult decisions, sometimes in very short frame of time, right? And you can imagine if this is not done properly, a bad choice may be made, or a choice that the patient or a family member may regret. So this are some of the reasons why we have to be very careful that anyone that is doing genetic counseling have the necessary skills and have the whole framework to work with. Right? And it works both ways. If you have a firm framework, you are also able to sort of protect the genetic counselors as well, so that there is less issues of malpractice accusations and so on. So there are, like I said, many other societies and established organizations that have come up with practice guidelines. So this has been described in one of the publications that we have also contributed to. And right from the very broad international overview, WHO has actually established guidelines for genetic counseling, although this was really put up very, very long ago. So as you can see, we are playing catch up here in Malaysia. But if you want to actually know more and read more, you can go to these organizations. These are well established, well respected organizations that have already developed the framework based on a lot of the evidence and a lot of improvements along the way. And these are areas where we can actually try and leapfrog and borrow some of the policies which are important and which I think are very pertinent to our society here in Malaysia. So that was the American National Society of Genetic Counsellors, which is the American system. The Australian system is managed and governed by the Human Genetic Society of Australia. But in terms of using genetic information, there are also very good recommendations from the American College of Medical Genetics and Genomics, and I think most of you may also be aware there are many guidelines, particularly in interpretation of results and so on and so forth, that are based on policies that have come up from ACMG. So what we intend to do in Malaysia, and that is currently ongoing, is to actually base and develop our own practice guidelines and credentialing for genetic counsellors who want to practice here in Malaysia. So this is done together through the society and with a lot of input from the clinical geneticists. So Prof. Dong and Dr. King, who are our special advisors, play a very major role in helping us develop this right now. So where we are is actually the conversations with the allied health profession division in KKM has already been ongoing for the past 2 years actually, and with the enactment of the Allied Health Profession Act recently in Malaysia, we now have the possibility of actually putting this through and having it legally recognized. So GCSM is now working very hard to put this through. And once this is done, there will be a pathway of credentialing for graduates in Malaysia in genetic counselling. Yeah, so this is very important because this is how we actually put a professional pathway to ensure that there is a established career path for those who intend to do the masters in genetic counselling. So, in summary, what I've tried to describe in the past 20 minutes or so is the situation that we currently have for genetic counselling in Malaysia, where all of the services are and so on. So we know that genetic counsellors are in demand. We know that it is necessary because it is recommended by guidelines for the use of the genetic information. We have to make sure that we are able to recognize the importance of genetic counselling when supporting patients who are considering genetic and genomic testing. Right? So this would also require us to put together the framework, and we can request for funding and support from our local governments. That if we have a framework, we can then train more local counsellors who are well versed in our local cultures, language, and religious needs. So next, there is a need to expand the training and to provide support to other healthcare providers, including the private setting, because that's where you will see more use of testing actually currently without proper counselling. So the professional recognition certificate and registration of genetic counselors in Malaysia and in Asia is of utmost importance, and that is how we want to make sure that we can regulate the profession, maintain the standard of competency and practice in accordance to practice guidelines, to have the professional ethics and within the medical laws of our own country. So with that, I end my talk this morning, and I will pass it on over to Azrin, who will then talk about the course and the training itself. Thank you very much for your attention.
Thank you so much to Ms. Yoon for the second part of this webinar, for your sharing. It was also very informative. Now for our final speaker of the day, Ms. Azwin. Let me introduce her before she starts her session. So Ms. Azwin did her Bachelor of Science and Genetics in UKM in 2006, followed by her Master of Science in Genetic Counselling in Cardiff University in 2014, and she currently works as a scientist as well as a genetic counsellor. She is also working as a genetic counsellor in HCTM PPUKM and was crucially involved in the establishment of the Master's Program of Genetic Counselling in UKM. She is also part of the Persatuan Genetik Malaysia or Genetic Society Malaysia, as well as the Genetic Counselling Society Malaysia. So without further ado, Ms. Azwin.
Okay, good morning. Okay, first of all, I would like to thank the organizing committee for inviting me, okay, to talk in this webinar. Okay, so my two colleagues, okay, Ms. Sui and also Ms. Juliana, okay, already talked about what is actually our role, okay, and what is the situations, okay, in Malaysia. And I'm going to talk about the training to be a genetic counsellors, okay, overall globally, and also training to be a genetic counsellor in Malaysia. Okay, so I just started, okay, to introduce the clinical genetic service team here in SCTM, and also we're going to start our service next week in May at Hospital Pakar Kanak-Kanak University Kebangsaan Malaysia. So as you can see from this picture, I have our clinical geneticist, Professor Zarinas, okay, and we also have a postgraduate medical officers that rotate, okay, and service in the genetic clinic, and we also have her assistant to coordinate the clinics. Okay, so this slide already mentions by Miss Juliana, and how to be training to be a genetic counsellor. Okay, usually training to be a genetic counsellor, you must have a bachelor degree, okay, either in science, biology, genetics, psychology, public health, social worker, and nursing. And usually most master's programs, okay, required experience, okay, the applicants to have experience of working in a caring role, either it's a paid, okay, works or is a voluntary works. And after you complete the bachelor degree, okay, if you have to pre-practice as a genetic counsellor, you must have a master's degree in genetic counselling. So that globally, there's countries that offer genetic counselling programs that I'll explain in details in my next slides. Okay, and definitely the ultimate aim, a genetic counsellor, for them to best practice is to have a board certification, which they aim to establish, maintain, and improve standard of practice in genetic counselling. Okay, with ultimate aim is to assure that public safety. Okay, so there's a regulatory board. Okay, different regulatory board, and each country is like mentioned by Ms. Sui. ABGC. Okay, there's a Human Genetic Society of Australasia, and in United Kingdom, Genetic Counsel Registration Board of United Kingdom. And definitely, the Genetic Counselling Society Malaysia is aimed, okay, to oversee the practice of genetic counsellors in Malaysia. So the Master Training Program actually started 50 years ago, started in United States, okay, in 1966 at Sarah Lawrence College. Okay, and about 20 years later, there are other countries that also provide master's degrees programs. And how about in Malaysia? Okay, so we receive approval, okay, from Jabatan Pengajian Tinggi, and now or KPT, in 2014, and we started, okay, to offer this program in 2015. Okay, just a little bit introduction at training to be a genetic counselor in the United States. Okay, so maybe the audience here or the degree students here, okay, would like to, enroll in the master's program in overseas. So in the United States, okay, there's accredited master degree programs. Okay, currently 51 accredited master degree program and 4 in Canada. Okay, and in United States, okay, most employers or most states are required the genetic counselor to practice, okay, have passed the certification exam by the American Board of Genetic Counselors, and after they pass the exam, they can using the title of certified genetic counselors. How about in Australia? Okay, so in Australia, there are also a pathway, okay, to be a genetic counselors. Okay, first that you have to, take a postgraduate diploma, as mentioned by Juliana before 2018. Okay, they offer postgraduate diploma, but now they only offer master degree programs. So, and after completed the master degree in genetic counselor, while in the process to receive a board satisfactions, okay, they will use a title of associate genetic counselors. And there's 2 programs in Australia, okay, that offer master degree, which is University of Melbourne and University of Technology Sydney. Okay, and then they have to complete the certifications process. Okay, and certification process involve supervisions, okay, doing reflection, doing logbook and AC. And Prof. Tong, okay, at UMMC is one of the certified clinical geneticists by SGSA to train genetic counselors. So we are lucky to have Prof. Tongs. Okay, and then attainment of certification is by the Board of Censor in Genetic Counselling by SGSA. Okay. How about training to be a genetic counsellor in United Kingdom? Okay, as I received my master degree in United Kingdom. Okay, so there's currently 3 universities in United Kingdom that offer master degree program. In United Kingdom, actually there is a 3 set of criteria, okay, for you to be a genetic counsellor. The first is through the academic route. Okay, so you enroll, you complete a master degrees programs in these 3 universities. Okay, or you can also be a nurse or midwife that have undergraduate bachelor degree or master degrees, and you have experience as a senior registered practitioners, and then you train, okay, in genetics and also counselling. While you're having this training, it must be training offered by a accredited university. Okay, so after you complete the 120 hours, okay, so you are eligible as a genetic counselor nurse. Okay, and there's a new pathway to be a genetic counselor in United Kingdom, that you are a trainee post. It is an on-job trainings that you get paid, okay, while you train to be a genetic counselor. However, using this pathway is very competitive, okay, because it's through the National Health System, okay, and they call it as NHS Scientific Training Program, STP Genetic Counselling, and it's a 3 years process. And in UK as well, there's a regulatory bodies, and most employers or most medical genetic service encourage their genetic counsellor to be certified, okay, through the Genetic Counsellor Registration Board. Just a little bit about academic road, okay, maybe part of, okay, the students here would like to embark. Okay, in United Kingdom, okay, Cardiff universities previously before 2016, they offer it as a 2 years full time. Okay, so you have to attend a physical, class. Okay, you have to go to clinical placement during your year 1 and year 2. You have to do a research. Okay, but after 2016, Cardiff University offered the program as a part-time distance learning. Okay, with work placement. Okay, so although it's a part-time distance learning with weekly online tutorials, you still have to come to Cardiff for face-to-face study block, okay, maybe twice or thrice in a year. Okay, the first year is mostly taught programs, and second year you have to undergo a clinical placement in a different genetic centers, and the final year is focused on dissertations. Okay, University of Glasgow still offering the programs as a 2 years full time. Before this, they call it a Master's in Genetic Counselling, but recently it changed to Genetic and Genomic Counselling. Okay, and this table here shows you that other universities, other countries that offer master's degree in genetic counselling, and also their regulatory bodies. Okay, so there's a course offered in Italy, Cuba, Brazil, Portugal, Russia, Spain, and also South Africa. Okay, how about master degrees in Asia Pacific? So there's our neighboring countries, okay, that offer this master degree, such as in Hong Kong. Okay, Taiwan, they started since 2003. There's also master degree offered in India, okay, and Indonesia, Master of Biomedical Science in Genetic Counselling. Okay, I've been there to train, okay, to attend their course, not just a weekly course, okay. Philippines, Master of Science in Genetic Counselling, okay, that offered by University of Philippines since 2011, and also course offered by Japan and also China. So as you can see, there's countries there, okay, that offer master's genetic counselling. How about training to be a genetic counsellor in Malaysia? Okay, so UKM, okay, started, okay, to offer these programs because, as mentioned by Miss Juliana, if you want to have a master degrees in overseas, you know, the cost is very high. So we tried to provide master's degrees, okay, locally. So just a little bit about UKM, maybe the audience here may be from internationals or overseas. Okay, UKM is has main campus in Bangi and Kuala Lumpur campus in Jalan Raja Muda Abdul Aziz. Okay, whereas the Faculty of Health Sciences, and we also have Cheras campus. Faculty of Medicine is in Cheras. Okay, so this is a little bit about the motto, okay, of UKM, inspiring future, nurturing possibilities, mengilham harapan, okay, mencipta masa depan. Okay, and UKM has academic staff of 2,096, which is 480 associate professors and 243 professors, with admin staff about 7,761, and registered student as of 2020, about 27,845. And okay, it is ranked 140 in QS World University Ranking in 2020, and also 13 for the universities that under 50 years old. So this program, Master of Medical Science Genetic Counselling, is offered under the Faculty of Medicine, okay, in Cheras. So Faculty of Medicine started in 1972. That offered the first batch is 44 medical students enrolled, okay, and HKL is used as a teaching hospitals and also first medical school to use Bahasa Melayu. Also the first local medical school to start clinical postgraduate courses. So in Faculty of Medicine in Cheras campus, we have 5 buildings, okay. Clinical block, where is the ward, okay, outpatient clinics. Clinical block, education block, where is the library dean office. Advanced surgical skills center to train the surgeons. And recently we have our new building, which is Hospital Kanak-Kanak, that we start outpatient clinic next week. So it is led by our Dean of Faculty of Medicine, Professor Dr. Raja Effendi, and the Deputy Dean and also Assistant Dean. Okay, UKM Faculty of Medicine offer undergraduate programs, and I would like to focus on just postgraduate programs. You offer master research coursework mixed mode and master clinical to train the specialists, PhD by research and clinical fellowships. We do have 477 lecturer or teaching personalities and a total of 2,000 postgraduate students. So how about Master Genetic Counselling is a mixed mode programs. Okay, so the first it is the first postgraduate genetic counselling program in Malaysia. Our first intake in September 2015, and our first intake we only take 2 students. Okay, and first batch graduation was in October 2017. At the moment, as 2020, we have produced 3 cohorts with 8 students graduated. The program is mixed mode, which is component of coursework and also research. At the moment, we only able to offer it as a full-time. I think as as mentioned, okay, it is it is a lot of things that we need to teach, okay, the student for them to be able to practice as a independent genetic counselors, okay, because they need to have clinical placement, okay. So it's full-time and Monday to Fridays, okay. So they are occupied with classes and placement. This program is accredited by MQA, okay, and it's a level 7, also benchmarked with international genetic counselling programs. When we started this program, we received input, okay, from university like Cardiff, Newcastle Universities, Diponegoro, and a few others. Okay, what is the aim of this program? Okay, the aim is to prepare students for clinical practice in the field of genetic counselling, suitable with the needs of qualified genetic counsellor in Malaysia, as mentioned, that are locally trained, okay, that fits with our cultures, okay. Okay, what is the objective of this master program? The first objective, okay, is definitely we would like to make sure that the students from these programs have a very strong basic foundations of human and also clinical genetics. Okay, not just they train in a scientific knowledge, they also must be trained to have a counselling skill knowledge. Okay, so they're going to work not only with patients and families, they also work with other allied health professionals, okay, like doctors, okay, and laboratories, okay, health professionals, okay, and also we also aim that the students, like the genetic counsellor, able to evaluate cases that require management from clinical geneticists, and which are the cases that they can independently manage, okay, considering of the social and ethical issues. Okay, not only that, okay, research is also a very important component in this program. So we hope that the students, when they have completed these programs, okay, as a genetic counsellor, they're able to conduct a clinical research related to genetic counselling, and our ultimate aim is definitely to fulfill the needs for qualified genetic counsellor in Malaysia. As mentioned, the country needs 200 to 400 genetic counsellors. Okay, what is the entry requirements? Okay, for this program is medical or dentistry degree from UKM or other universities, or you can have a bachelor degree in pharmacy, nursing, or science, okay, or psychology or counselling from as your first bachelor degrees. And for those with a bachelor degrees, okay, one of the prerequisite criteria, if you come from a bachelor degree in science, we require you to have 3 months clinical experience, okay? Either it's a paid or either it's a voluntary. And selection of the candidates will be based on the interview after shortlisted by program coordinator. So you submit your applications and we will call you for an interview, okay? Okay, so this is our team members. Okay, the head of the program is our clinical geneticist, Professor Rinas, and we have Dr. Aditi as program coordinator, and me myself with the help of two staff, Encik Razwan and also Mr. Sitino Farahin. Okay, what is the module? Okay, what you'll be taught if you enroll in these programs? It's a 2 years program. So during semester year 1, okay, you will learn all the basic foundations, human genetics, clinical genetics, basic counselling skills. Okay, so moving to semester 2, okay, you will learn about the genetic disease. Okay, and also you start to have your clinical placement, okay, at different genetic center, and you start to have doing research. And when you are moving to year 2, okay, you will still learn about genetic counselings, okay, and you also will learn about dissertations, okay, continue your research, okay, and during semester 2 of the year 2, is basically is your clinical placement and your research. Okay, so more details about what we teach in human genetics modules is a basic science. Okay, you will learn about cell biology, cytogenetics, molecular genetics, biochemical, cancer genetics, and you will also go to laboratories, okay, to learn about the principle of genetic technique. Okay, you will learn how to interpret, okay, the genetic result. And for clinical genetics module, you will learn all the things regarding like how to construct 3 generations, okay, how to do risk calculations, okay. You will learn about all the inheritance pattern, autosomal dominant, Mendelian, okay, X-linked, mitochondria, and you will also learn about embryology and pregnancy. Because as mentioned by Miss Juliana, there's you will consult regarding prenatal diagnosis or pre-implantation genetic diagnosis. So it's important for you to learn about the embryologies and pregnancies. Okay, you will learn all the genetic diseases, how the clinical management aspect of genetic disease, and importantly to learn about medical and psychological and familial implication of genetic disease towards the families, okay, towards individuals. And for genetic counseling module, okay, that you will learn about all the counseling theory and models. You will learn about the basics and also advanced counseling skills about bereavement, about grief, okay, and about how to work with adolescents, children, older people, couples, okay, and personal development and professional conduct is also an important component. And learn about the ethical, legal, and social issues. You will have lots of role plays and rotation in community center. Okay, as you can see from the pictures, okay, there's a role play and what we do in the in the class, okay, which a student will explain, okay, will practice, okay, their counseling skills, okay, to another students that act as a clients. So how about clinical practice? Okay, so starting from year 1, semester 2, and also year 2, you have an opportunity, okay, to go to a genetic centers in HKL, okay, UMMC, Hospital USN, okay, in our own hospital SCTM and also FGKK and also Cancer Research Malaysia. So you will do an observations there, and also if you will be appointed clinical supervisors, and if your clinical supervisor think that you are deemed ready, okay, so you can also have a direct contact with patients, maybe to take family histories, okay, to take pedigrees, okay, to explain inheritance, okay, and also maybe to explain about the genetic testing, okay, or post-test result, okay. So if you are deemed capable by your supervisors, and it's definitely under the supervisions, okay. So as I mentioned, it's a full-time program. So you have every week, okay, you will have the clinical placement 3 days or 4 days, okay, throughout the academic calendars. And yeah, as I mentioned about research, so you will learn a research methodology, and then you need to prepare a research proposals and obtain ethics approval either from the Ministry of Health or each hospital's ethics, and data collection, analysis, and definitely towards the end of semester 2, you have to present your clinical, your research finding and submit manuscript. Okay, this is a little bit about the teaching members. We have our own, okay, in-house lecturers from clinical geneticists, genetic counselor, myself, molecular geneticist, clinical psychologists, psychogeneticists that will teach the students, and we are very pleasure to have our visiting lecturers. Okay, so we do have clinical geneticists such as Dr. Ngu, Dr. Winnie, okay, Dr. Kang, and Dr. Chung from Hospital Penang, and Prof. Tong as well, and Prof. Zulfalil as our visiting lecturers that teach the students. We're also very pleasure to have people like Miss Juliana and Miss Sui, okay, that also, our visiting lecturers that involved in the programs, involved in teaching the students. And for you to be able to, obtain the master degree, you must have obtained a minimum CGPA of 3 and above, and pass all the compulsory courses, and definitely to make all the required payment. Okay, I would like to show a little bit about our student activities. They are not only day-to-day, attending class, or attending clinical placement. We also encourage them to participate in outside activities. For example, we are very pleased that 2 of our students, received travel grant from Genetic Counselling Society Malaysia to attend the 13th Asia Pacific Conference on Human Genetics in Filipinas. So in these pictures, we have our students that volunteer on Rare Disease Day. They also volunteer during the launching of Genetic Counselling Society Malaysia in September 2019. They volunteer in Genetic Day at schools. And apart from that, in the physical activities, they volunteers in the autism walk. Because during their first year, they will have a community placement. So they will place in like an autism center or Kiwanis. So during that time, they involved to be, in organizing, for example, fun run. So we really encourage them to participate in outside activities. And at one point of time, they also be a volunteer in the Prader-Willi syndrome camp organized by Hospital Kuala Lumpur. So a little bit, as I mentioned, we already have 3 cohorts graduates in these programs, and just mention a little bit where are they now. So we have Miss Susanna. Miss Susanna is currently the head of psychology counselling unit, and also she's playing a role as a genetic counsellor for outreach genetic clinic at Hospital Wanita Kanak-Kanak Sabah. So there's a clinical geneticist from Hospital Kuala Lumpur that have outreach clinics there in Sabah. So during their visit, Miss Susanna will help the consultant. How about Miss Tiong Xing Yi? She is currently a genetic counsellor at Low Guan Lai Specialist Centres, Pulau Pinang. And 3 of our grads are as currently a research assistant at Faculty of Medicine UKM and planning to enroll in a PhD program soon. We have Miss Tarasini. She is currently a genetic counsellor at Kuri Oncology Mount Elizabeth Novena Hospital in Singapore. So we are quite happy that our grads are accepted by that Singapore to practice as a genetic counsellor. But definitely she have to undergo a certain process and interview before she is recruited in that centre. We have Miss Chia Yiling. She's a clinical scientist on Low Guan Lai Specialist Centre at Pulau Pinang. And we have our first international students, and also already graduated, which is Miss Suat Ali. She's currently a genetic educator and clinical coordinator at Viafred Genomic Center at Dubai, and she's currently planning to register as a genetic counsellor with the regulatory board in Emirates. So this is if you would like to have more info regarding the master's program, by UKM, you can just surf, go to this website. And I would like to inform that for September and October 2021 intake, the application is now open, until end of June. So here, if any of you interested, to join the program, and we are very welcome for you to apply. Miss Julian and so already mentioned a little bit about career pathway of genetic counsellors. So traditionally, you can have practice as a traditional clinical genetic counsellor when you have a direct contact with patients. But there's a different career options. You can be in a laboratory or industry genetic counsellors, which you are liaison person to the laboratory customers. For example, you advise physicians and also others who order genetic tests. What is the most appropriate genetic test options? You can also provide education to healthcare professionals about genetics and genetic testing, helping in interpretation of the results, and also guide the prioritization of urgent samples in the labs. And you can also be a research genetic counselors, okay, that you conduct your own research. And also in terms of you can be a person, okay, that provide patient recruitment, okay, especially in a genomic research. As you know that if you are trained as a genetic counselors, okay, you have a high level of scientific knowledge and able to comprehend that complex and also technicals, okay, terms into a lay language, okay, and you also have a definitely a counseling skill, so you will be a very invaluable asset, okay, for a research team, okay, especially in a genomic research. And not only that, as mentioned by Miss Juliana, you can be involved in the public health, develop public policy related to genetics, and also involved in a non-profit organizations, okay, such as support group. So provide education to professional and community groups, okay, improve access to genetic services or for patients or at-risk family members, and advocate the affected and at-risk family. Okay, before I end, okay, this is my summaries. Okay, this is a paper that was written by Miss Yun, Sui, Prof. Tongs, and also Dr. Kang, that Malaysia needs more genetic counsellors. Okay, and I hope there's a better career pathway for genetic counsellor trained in Malaysia. With that, I thanks everyone. Thank you.
All right, thank you, Ms. Azwin, and thank you again to all three genetic counselors for your input. Now, before we move on to the Q&A session of the webinar, let us take a short break so that we can compile all of the questions that have been asked by the participants. All right, so hello, welcome back everybody after this short break. So thank you again to all of the genetic counselors for your input. Now we have come to the Q&A or question and answer portion of the webinar, and there are a few questions that have been put forth by the people who have been watching this webinar. So, okay, the first question is, may I ask if there's an intake for the Masters in Genetic Counselling every year, as I have just started my Master in Psychology and anticipate to complete end of 2022. Is there an intake in 2023?
Okay, okay, thank you for that question. Yes, at the moment, okay, we offer the programs every year. Yeah. If we receive, like applicants, definitely. Yeah, 2023, I think, yeah, will be, like intake. No?
Okay, thank you for your answer, Ms. Azvi. The next question is, one of the requirements to enter the master's program is clinical training. How are we to get this clinical training as non-clinical degree holders?
Okay, and I anticipate that the question is asked by a science graduate, right? Okay,
Yes.
so if you don't have clinical, it not just limit to clinical experience. Okay, it can also be a community kind. Okay, that involve like voluntary. Okay, work. Okay, such as you maybe have volunteers in the orphan homes. Okay, or you are volunteers in autism, okay, or centers, or maybe during your studies, okay, you are volunteers, okay, in any sorts of that have human, okay, related kind, that is kind of a voluntary works, okay, that also like count, okay, as a uh, prerequisite criteria to enter the programs, okay. And if you really don't have any of those, like volunteer, like experience, okay, when once you have, like keen, okay, to join, okay, or to apply for these programs, okay, you can let us know, okay. So sometimes we can assist you to get that kind of placement for you, okay. Yeah, if you really can't get any of kind of volunteer works, okay, just let us know. Sometimes we can provide, okay, or assist you, okay, where or when or where you can get those kind of experience.
Following up to that question, does it count if, like, say, I do my internship at a clinic in the hospital? Does that count also? Or does it need to be a separate voluntary thing only?
Okay, it can be count, but we really need to what kind of clinics, okay, that you have your placement, and how long is the clinical placement? Is it 1 week, okay, or is it like for the whole semesters, okay? We really need to take into account that as well, where and how long.
The next question is, can other program students, such as microbiology postgraduates, apart from genetics and biology postgraduate programs, can they join the master's program in genetic counselling?
Yes, sure. It mentioned that microbiology, yes, we accept those with science background, not just limited to genetics. Yeah.
Another question here is, are there currently any activities or organizations available for other students to participate in?
To participate, maybe any, Juliana?
What kind of activities?
Sorry. So there will be from the GCSM side as we gear towards the later, usually the third and fourth quarter is when we do the webinars, the workshops, and so on. So there will be some that will be in place. But do look us up in either on social media. We also post activities from other organizations as well. So we are involved with most of the other organizations that work with genetic diseases as well. So do follow us on social media as well, and you'll get more information. So it will be towards the later part of the year where we hope that there will be, hopefully there'll be less restrictions, and with proper SOPs we are able to set up some of those activities.
Yeah, I'd just like to add, for PSGC, I think this year we had a webinar recently by one of the genetic counselors from India. And last year when the pandemic happened, we had our first webinar on telegenetics that was presented by a genetic counseling from a genetic counselor from Hawaii. So if you also follow our social media on PSGCA, hashtag PSGC in Asia, or from the website, then you can be updated with all the events that we have.
All right, thank you. Another question is, does any genetic counselling programs or departments in UKM or anywhere else in Malaysia offer internship opportunities of any sort?
I think each place will have its own sort of criteria. So there are actually internship possibilities. So even in Cancer Research Malaysia, it is, but it is a competitive internship. So there are, the best is to actually look up for each of these individual websites, or actually to go directly to see what openings are available. Bearing in mind that due this year and last year actually is particularly challenging, mainly because of social distancing and limitations due to SOPs. A lot of the physical internship is no longer possible. So I would urge for everyone to be more open-minded in terms of where their learnings and internships can be. A lot of things can be done online as well. So we do hope that the situation will improve. It should, but each individual institution actually has different sets of criteria for their internship. So have a target in a sense, and then you can reach out to the society as well, and we will point you into the right person to get your information for. But there is no sort of like overall internship program that is the same throughout the organizations.
All right, thank you, Ms. Yun. Another question from Shasha Haris. If I'm a Bachelor of Dietetics graduate and I went for 2 months clinical placement at the hospital as a trainee dietitian, does that count as clinical training or experience to apply for this course?
Oh, okay, yes. For those that in a bachelor degree is allied health, okay, programs, so they are considered as they have a clinical experience. Yeah, and I hope that answer question the question by Shasha. Yeah, because the dietitian is a allied health programs. Yeah.
I have a question by Rishika. For the prenatal testing, when will the mother be given the option for terminating the pregnancy? Under what conditions?
I think termination of pregnancy is something that the patient has to discuss with their attending doctor. Generally, I think in the legal provisions in Malaysia, in the civil law, if it causes the pregnancy causes harm to the health of the mother, which includes the health, psychological health, and physical health, then it should be allowed with the opinion of the doctors in consideration. So I think that's all I want to comment, because I think I won't know much in this field. I think it's best to also consult a medical doctor on this.
Thank you, Ms. Juliana. General question for any of you. How would you recommend an aspiring genetic counselor to network with established professionals in the field?
Well, as you can see that the fraternity is not very big and every one of us are very approachable. You will be able to find us in all of the organizations that we're in. Drop us an email. We all respond to emails, right? But that is also where the society is placed in a major role in, the networking part. So when you message the society, we will try and put you in touch with the person that's most relevant to your questions in that sense. Yeah. So just drop us a line. You can write to us directly. You can go through the society, and someone will respond with regarding your interest in networking. So at the moment, Malaysia is still it's a small community of clinical geneticists and genetic counselors. So we all we work together. So it really, but everyone has their core expertise and areas of practice in different hospitals. So just reach out to us by sending us an email, drop us a line, and we will try and put you in the network that is suitable.
So I would like to add, in the past few years, since before 2015, there was really not many of us in the country or in the region. So there was just this few of us. But as soon as we gathered more genetic counselors that we were introduced to or conversed by email, and that's how we actually gather all these contacts to set up the PSGCA. So every 2 years, we actually look forward to the conference, the APCHG conference, because we know that we would organize the pre-conference, which is the genetic counseling workshop. And as you can see from the photos, there's a huge number of genetic counselors from all the most of the countries in the region, especially from Philippines, Indonesia, Malaysia, Singapore, and also from North America as well, that actually join us. So it's actually a very meaningful and a very feel-good moment to actually see all the other genetic counselors in our region and all of us gather in the room. So hopefully when this pandemic is close to over and the borders are open, we were supposed to have the next conference this year, but I believe maybe it will be deferred to the next. So maybe like if there are conferences available, you can follow our social media and keep updated, and you can join us for physical networking.
All right. Thank you, Ms. Juliana. So I have one final question. Hopefully it's a question that all three of you can give your own answer for. What advice would you give an aspiring genetic counselor?
I think I'll start. So if you feel that you want to become a genetic counselor, I think you really need to dig deep to see if you are able to, you have the characteristics and the passion for it. because just like any other profession, when you first start out, it may not be easy and can be quite challenging, especially with our developing profession now. But do have hope, like how I felt when I was considering if I wanted to become a genetic counselor, and there were really no job opportunities then, like almost 20 years ago. But I took the plunge and pursued to learn about it. So and I was very lucky that I had a clinical geneticist and my superior at work, and opportunities that came along the way throughout the years. So with hope and a passion, I think anything is possible. So keep that interest going. Sorry?
Sorry, I forgot to unmute. Yes, so building on to what Juliana said, genetic counseling is a just like how making a decision for a patient is a very personal decision. Working as a genetic counselor is also a very personal decision. We all have reasons why we want to go into certain careers, but this is the one career that you are actually in a very multidisciplinary kind of environment. So your primary person that you're serving is the patient and the family members, but at the same time, you are a conduit between the other health professionals, all other areas. Sometimes you even have to help with the social welfare component, the finance, the payment, and so on. So in the heart of it, you're actually helping someone else, and that's where the fulfillment comes in with this role. It's a good time now to get into this role. 20 years ago, when we started, it was a little bit more difficult. Also, with the increased need of genetic information across the board of all sectors of healthcare, right? We didn't even touch on direct-to-consumer testing and all those sort of issues, but there is so many different opportunities to move into this career and to grow it, right? So this is also genetic counseling is also not static one. It needs to evolve, it needs to grow depending on the needs of the patient, depending on the needs on the overall society. So I personally feel that this is a very exciting time to go into genetic counseling. It is sort of a very fulfilling role, and I hope you will all consider it. So that's my 2 cents worth. And to you, as
Okay. Okay. So my advice for the inspiring genetic counselors, and which I very, very welcome, okay, for those that are interested in this career to join us as a workforce. Okay, 5 years ago, you only can, take master's degrees in overseas, which cost you a lot of money. But I think nowadays we have our own local programs, and yeah, the program have input from from the expertise. Okay, and it's a very, I think, fulfilling careers. Okay, and it's, as mentioned by Julian as well, you need patience. Okay, when you join genetic counselor as a careers, and it's a moving careers. For examples, when we started when I started as a genetic counselors, okay, I only able to counsel for 2 and 3 genes, but nowadays, okay, we already, counseling for whole exome and whole genome, sequencing, genetic testing. So you just need to keep update yourself with the knowledge, okay, and keep your patience, okay. When you talk with your patients after every time of each clinics, okay, you will feel that it's a fulfilling, okay, which you can help patients, okay. It is very interesting when you have a patient that they really don't want to have another child because they think that this will occur again. Okay, but after explaining, okay, it depends on the conditions. Okay, and after explaining that maybe is the risk is low. Okay, because they are not the ones, okay, that contribute to what their children have. Okay, so it's really, I mean, like something that you will gain, okay, after the clinics. Okay, giving informations to your patients for them to make right decisions. Okay, and I welcome everyone to join these programs. That's for me.
Okay, that comes to the end of the Q&A session. Thank you once again to all three genetic counselors. Now let us invite Dr. Heriawan Riyadi, the advisor of the Genetics Club and head of Genetics program, to give his short closing remarks.
Okay, thank you, Mr. Yashwin. Assalamualaikum and good afternoon. So first and foremost, on behalf of the genetic program, I would like to express our appreciation to the speakers, Miss Juliana Lee, Miss Yung Soo Yi, and Miss Sharifah Azwin for spending their weekend today to share about genetic counselling with us. And as for the student who interested in becoming genetic counsellor in the future, I think our speaker have shared a lot of info with you. Do take note on the important point explained by the speakers, the job description, the requirement, and the opportunity available for you. And finally, my deepest gratitude to our project director, Mr. Hashvin Ravichandran, and the committee members, our moderator, Mr. Yashwin Kumar, for their effort and contribution in organizing this informative webinar. Today's webinar has brought benefit not only to the student, but also to the genetic program itself. Thank you.
Thank you, Dr. Harry, for your kind words. And so we have come to the end of this webinar. I would like to thank Ms. Juliana, Ms. Yun, and Ms. Azwin for your amazingly useful input, and hope that all attendees have really benefited from this webinar. All participants, please wait for the QR code for attendance and feedback so that we can give you your e-certs later on once you have filled in the form. Thank you and have a nice day.